I thought it would be prudent to give you some of my history. How did I get to this point? I was really keen on wanting to specialize as a dentist. I knew that I had to make a choice of what specialty, and I knew for sure endodontics wasn't be the one. I really did not enjoy endodontics at dental school, and so that was not going to be the one I did. And orthodontics I was keen on, but I came to learn something very interesting about myself, that whilst I enjoyed orthodontics, the intelligence and academics behind it, what I did not enjoy was the remote control aspect of it. In other words, you want to move a tooth to a more ideal position, you can't just move the tooth. You have to use a spring intelligently in such a way, or bend a wire intelligently so that the tooth would move to where you want it to go. And then, of course, you'd have to give it the time to find out whether it moved to where you want it to, and then correct or advance it more. And somehow that just did not resonate with me. So I came to understand that orthodontics was not going to be acceptable either. But what I did enjoy was prosthodontics. I enjoyed surgery. In fact, I thought I was going to be an oral surgeon. But then I noticed that just doing surgeries day in, day out, wisdom teeth day in, day out, it also became something that I felt was just not good enough. And then I was really in a quandary because I'd already done the subjects for specialization, what we call the primaries in South Africa, and then it was now the time to dedicate yourself to the specialty, which I could not do because I was not sure which one to do. And I really did not want to exclude myself from any other specialty. And so a good friend of mine, Ed Bonner, mentored me, and he said to me, well, then just be a generodontist. And that made sense, a generodontist. In other words, elevate the level of skills of all the specialties, but practice as a general dentist, meaning that I have the fluidity to practice and interconnect the different specialties. That is what I did. As a young dentist, newly qualified in 1978, I had to complete my military draft. It was a 2-year program, and as I was already a qualified dentist, I was seconded to various units in the military. This is, by the way, the South African Defence Force. And one of the early programs that I was sent to was a school of young kids in Soweto. And Soweto, so you may know, is a township in South Africa just outside of Johannesburg. And so the government provided dental services to them, and I happened to be the dentist assigned to the dental services that very morning at this particular school. So I arrived, and the process was fairly simple. I had to treat 10 patients, followed by the next 10. So it would work by me diagnosing the first 10, anesthetizing them, and then seeing the next one, until eventually the 10th person was anesthetized, and then we went back to the first and started the procedure. And typically they were fillings. These were young kids, maybe 9 or 10 years of age, so the majority of them required fillings. And in those days, we only used amalgam fillings. So the experience I had with this very soon was a tooth requiring an MOD amalgam filling. But it was a large size one, very extensive, and it was a first molar, and obviously an important tooth, a tooth that we would not want to remove at all costs. And so the procedure went quite normally, and when we got to the point that I needed to place the retainer with the matrix band on it, the nursing assistant, the dental assistant, said to me, "Oh, sorry, doctor, we don't have any matrix bands. They're on back order and we hope to get them soon." I said, "Well, what do you mean soon?" And she said, "Well, it could be a few weeks." So now I'm in the predicament that this young patient has had the prep done for the filling and I have no matrix bands to work with. So I had to come up with an alternative. And a matrix band, as we all know, is a very inexpensive but a very vital tool. But without having it, it was one of the most difficult and challenging procedures I had, to try and somehow compress the amalgam into every corner of the MOD without violating the basic protocols of a good filling. Anyway, I've finally got through it, but the amount of psychological trauma that left me with, I just kind of felt maybe I'd made the biggest mistake in my life by being a dentist. And then when the sort of initial sort of anger or anxiousness settled down, I realized, no, it's not dentistry that's the problem. Maybe the problem is actually the way the dental office is run, which is a very different kind of problem now. So very soon on, I decided that I was not going to be working for other dentists, and I would be getting into my own practice. And that's what happened. As soon as my military training was completed, I did just that. I bought a practice. I knew nothing about dental practice at all, but I knew one thing, that at least I could run it the way I wanted it to be, which meant that I could have the materials I wanted and administrate it the way that I felt comfortable. And it was obviously a jump into the deep end. I don't know many dentists that follow that route, but like most things in life, if you jump in the deep end, generally you will learn a lot about yourself and become more resourceful. And so I think it was a good move for me. So that gave me one event which was very important in my life. So all of that sequentially has helped to shape what I do and how I operate as a dentist. And I'm still doing it today after 46 years of being in practice, mostly in full time for myself. That gets me to why I've chosen that path. I mean, there are obviously different options of operating. They're group practices, and they all have advantages and they all have disadvantages. For me, I like autonomy, and whilst I certainly respect the team I work with, I also have challenges dealing with multiple clinicians and referring back and forth. And my experience with that has been somewhat less than lusterful than I'd like. And so I felt that the more I can do with my patients, the more coordinated their treatment and the more balanced it is. And so that has essentially spearheaded and prodded me to expand all the treatment modalities I offer my patients. And so not only do I do prosthodontics, periodontics, oral surgery, hygiene of patients, I've now got into the implants, because when I qualified, implants did not exist. So I've gotten into that. So to put it all together, my career in dentistry has been a growth, a journey that started off with being unable to put a filling in because of one simple retainer with a matrix band that was unavailable. And that taught me to be a lot more resourceful. And that resourcefulness actually has continued throughout. Then the other elements, such as the what to specialize in, that led me into being a general dentist that could undertake far more advanced procedures following the dictates of the specialty that they operate in, with the huge advantage of being able to coordinate different specialties, which is certainly not the case if you employ individual specialists on a part-time basis. So that was a big defining moment. Another defining moment was a practice that I worked in when I came to the United States in approximately 1994. And this practice had a lot of older people in it, more senior people. And what I noticed with the senior people were two things. The one is they generally had let their mouths deteriorate, and more so when there was anything suggested to them, they would say, well, I don't know how much more time I have left to live, so why fix it? That perspective is very important because it made me realize that the decisions we make with our patients in their earlier years, it's what's going to result in their later years of dental health and comfort. And as I would come to experience many years later with my own mother in her 90s, being in a facility where there were other people in their similar age groups, so many of those people were very uncomfortable with their mouths. They were missing so many teeth. They could barely eat. Their food had to be macerated so that they could at least swallow it. And of course, the actual diet variety was so limited because of that. Their roughage was compromised. And so these people who had many infirmities at that age, very aware of them too, and some with dimensional problems not so aware. And so one of the only pleasures potentially they could have was chewing food and eating nice food. And without their teeth there, they couldn't even do that. The dignity, or maybe more aptly, the indignity that those poor people suffered just bothered me tremendously. And again, it reinforced the obligation and power we have as dentists to make sure that our patients have the best chances in their older life. So who would benefit from this program? I believe that is a dentist who feels that they want to undertake more, expand their repertoire, not allow themselves to get burnt out by consistently having to redo and replicate the same procedures. Eventually they get tired of doing them. So the more you can expand your base of knowledge, the more you can integrate, the more you can offer your patients, the more it's good for them and the more it's good for you. And so this is for general dentists who do not want to specialize in any specific exclusionary specialty, but for dentists that want to really have a full career, that can enjoy doing it. This is what I've done, and I like to believe there are other dentists who might want to follow a similar kind of path. My name is Dr. Basil Gordon, and welcome to my Gild.